We all come from the same background, like we've danced our whole lives and we just want to keep going a little bit. We dance at halftime for all the athletic games. We do a competition a year, and we kind of follow like a style of like more jazz, halftime type of routines, but we're trying to incorporate like lyrical and contemporary this year. So. Most practices are in the morning, but that's also a downfall about it, is most practices are at 6 a.m. So being a commuter student and having a puppy that I take care of in the morning, I need to wake up at 4:45 in the morning, so it's like an early morning. However, you do what you have to do for something you still love and still want to keep up with. I've always wanted to be a pediatrician. So originally coming here, I thought, okay, I want to be pre-med. I since changed to pre-PA, so I need to do biology or chemistry, like follow the mold. And I learned that you don't need to do that, first off, to get accepted. And second off, I learned like what public health has to offer over a lab science what has to offer. It's kind of, public health is like the backbone of medicine. It explains everything that you'll address in the clinical setting, rather than saying like, oh, they have a cough, I'm gonna treat it with X medicine or X treatment. You say, oh, they have a cough, like where do they live? Do they have environmental exposures? Where, and it can just go so much deeper than a superficial clinical setting, if that makes sense. I work at Families First Pediatrics. I'm a medical assistant there. But the great part about working for private practice is, well, I guess really anywhere they probably could teach you, but especially where I work, they teach you a lot of things that typically isn't within a medical assistant's scope. So I can do labs like blood draws, I can hook up IVs, I could stitch if I really wanted to. I assist with things like circumcisions, broken bones, x-rays. I vaccinate kids all day long. Like I love it. I love what I do. I love being with the kids. It's my favorite part about it. I'm the president of the Public Health Club on campus. We go by the name PHAT because that's the name that it kind of was before the club had shut down before. But yeah, it's really good. We're just trying to encompass everything that public health is, but really focus on community engagement. We're a new club, so we've only done one like actual service project so far. It was last semester, spring semester, and we did a hygiene collection drive for refugee populations in Salt Lake, and it went so well. We collected items on campus. We had like bins. We also collected money to go buy things, and then we requested some extra funds, and we ended up making 120 packs. Yeah, it went really well. We got to help so many people. It was really fun. We had a drop-off day, and so all the officer members got together, and we took them and dropped them off, and they were so appreciative. So it went really well. But so that's all we've done so far, really. We also host the blood drives on campus, which is good because donate blood. I know other people have experienced this too, but getting him and bringing him into my crazy life, it added so much to my schedule. Like I need to wake up earlier and make sure he's taken out. I need to be sure he's fed. I need to be sure he's taken care of all day long. And I'm doing training with him to be sure that he's like a good boy and I can bring him with me in public when he gets a little older. But it's literally decreased my stress level by so much. Like there's really something to say about animal therapy, because coming home after you have your day and they just love you, like you're their whole world, it like really makes you feel significant in a day that you might have felt like nothing.